And my testimony is going to be geared towards the medical field and the treatment of patients who have disabilities. This testimony is directed at Dr. James L. Madera, MD, Executive Vice President of the American Medical Association and Deans of Medical Schools in the United States of America and in the Western New York area. I feel the training of medical students and doctors on the subject of disabilities should be a mandate because it is crucial that the disabled community receive medical care and understand the care that they are receiving. The numbers are very surprising on training of medical students and doctors on disabilities and how to go about speaking to patients. In a survey exploring the training of healthcare professionals, more than 80% of U.S. medical school students report receiving no clinical training regarding people with intellectual disabilities. 66% report not receiving enough classroom instruction on intellectual disabilities. More than 50% of medical and dental school deans report that graduates of their programs are simply not competent to treat people with intellectual disabilities, and more than half of students agree. Additionally, 50% of U.S. Training to treat people with intellectual disabilities is not a high priority, with most citing lack of curriculum time as a primary reason. Even though they report lack of instruction, approximately 75% of students express interest in treating the people with intellectual disabilities part of their careers. If given the opportunity, meanwhile, almost all administrators say they would implement a curriculum regarding treatment of people with intellectual disabilities if given one. I had the pleasure of speaking to two physicians, Dr. Jacqueline Gonka, a urology resident in going to the University at Buffalo, and Dr. Nathan Clark, who is a podiatrist who does surgeries, about if they had any kind of training on different kinds of disabilities and how the best way is to speak to people with disabilities. Both doctors stated that they didn't have any kind of training on these topics, they wish they had more training. I've had a personal experience with not having a doctor speak to me directly during my care. The physician just spoke to my mom about the medications I was on. In all reality, the doctor should have been speaking to me because I was the one who was taking the medications and who would know what side effects I was or was not experiencing at that time. I've wished that the doctors would listen to me more and accept me for who I am. My doctors have learned the best way to communicate with me, but I had to teach them. I feel that all doctors and medical students should be required to take classes on how to treat people with disabilities. I will be happy to help you in any way possible. I will go as far as going into the classrooms to speak about what I have personally gone through. Thank you for taking the time out to listen to me speak.